Hi everyone, my name is Dr. Jamie Snell. This video is intended to provide information to residents of Freedom House Detroit who did not attend the virtual panel discussion held on May 22nd. We hope that you will find the information in this presentation useful and educational as it relates to COVID-19. As a brief introduction, this presentation is part of a larger program known as Freedom Cares. Freedom Cares is a collaboration between members of the Wayne State University Global Health Alliance and Freedom House Detroit. Its goal is to provide health education, health advocacy, and health consultation to the residents of Freedom House. In the months ahead, we will continue to provide in-person and virtual presentations such as this one to equip you to better understand and utilize the American healthcare system. For the original presentation that was held on May 22nd, the following members were present to provide information and answer questions as part of our expert panel discussion. They were Dr. Kanzoni Asabichi, a representative of the Detroit Health Department, Dr. Ijeoma Nodim Opara, one of our representatives from the Wayne State University Global Health Alliance, and myself, Dr. Jamie Snell, also a representative of the Global Health Alliance. Although that session was not recorded, if you do have questions following this presentation, please relay them to Freedom House staff and they will share them with us so that those questions can be addressed. So here are a few questions that will provide an overview of what we will be discussing in this presentation. What is COVID-19? Why has this pandemic caused so many problems? How has this affected me and you? And unfortunately, the question and answer portion will have to be done through indirect communication. So what is COVID-19? As you may know, COVID-19 stands for coronavirus disease that began last year in 2019. It's caused by a virus known as the SARS-CoV-2. That name represents the fact that it is responsible for severe adult respiratory syndrome caused by the coronavirus. The number 2 indicates that this is the second SARS outbreak. The first SARS outbreak, as you may remember, was in 2003. A similar outbreak caused by a different type of virus was in 2012 and was responsible for the Middle Eastern respiratory syndrome. Why has COVID been so dangerous? Well, unfortunately, our immune systems have not seen this particular type of virus before. This has earned the name novel, which is something that you may have heard before, novel meaning new to the human race. Because the virus is new to the human race and the human immune system, there is no protection that our immune system provides for us to fight the virus. Other examples of where viruses have been transferred from animals to humans include HIV, the bird flu, and swine flu. So how does it spread? The most common way the virus spread is through contact with someone else who has the virus. If a person with the virus coughs or sneezes, they can create droplets in the air that someone else might breathe in. Or if a person who is infected coughs or sneezes on a surface or touches a surface with contaminated hands, then someone else can contract the virus if they touch that surface and then touch their face, mouth, or nose. Scientists believe that the safest distance to avoid breathing in droplets is about 2 meters. And this information is the reason behind public health recommendations to social distance, wear masks, frequently wash your hands, avoid touching your face, mouth, or nose, and disinfect surfaces often. It is also the reason why anyone who does have the virus or has symptoms suggestive of the virus should isolate themselves to prevent spreading it to others. So what are the symptoms related to the virus? If you've been reading the news, you know that the symptoms have changed. Early on in the pandemic, it was simply described as being concerning if you had fever, difficulty breathing, and cough. Common symptoms now include headache, runny nose, sore throat, muscle pains, and a general feeling of being unwell, in addition to high fever, trouble breathing, pneumonia, and serious infections known as sepsis. There's also been a small number of cases that have presented with GI symptoms such as abdominal pain or diarrhea. The symptoms may appear anywhere between 2 days or 2 weeks after being exposed to someone who does have diarrhea. Concerning symptoms also include a sudden loss of smell or taste. How long does it take to get sick after being exposed? This is what is seen in most cases, although it may vary from person to person. After being initially exposed to the virus, within 4 to 6 days, which is called the incubation period, is typically when symptoms will begin, although it can take up to 14 days before a person develops symptoms. After a person develops symptoms, the illness lasts on average about 10 days, but can last longer, up to about 2 weeks or more. What's important to be aware of is that even before symptoms develop, 1 to 3 days before they develop, you may be able to spread the virus. This is known as the infectious period. It can last from 1 to 2 weeks as well. Following onset of symptoms, someone is isolated for about 2 weeks after being allowed to no longer be isolated, and after that time period, we assume that they are unable to transmit the virus as long as they do not have symptoms. How do they test for COVID? There are generally 2 types of tests. The first test for a present infection, and the other test for past infection. The present infection test, also known as a nucleic acid detection test or an RNA test, is performed by placing a cotton swab either in the nose or into the mouth and then analyzing that swab for evidence of the virus's RNA. The second type of test is a blood test. This test looks at whether or not your immune system has formed a defense against the virus. This defense is in the form of antibodies. The virus may not be detectable immediately after the infection, and so we call that a false negative. And the antibodies may also not develop immediately after the infection. And so if one of these tests come back negative and was performed too soon, then someone may in fact have been exposed or have later develop immunity. Does everyone with COVID belong in the hospital? This is a very important question. We all know that some who contract the virus become very ill and require hospitalization in order to get special treatment, whether that's in the form of medications or support for breathing if their respiratory system is significantly affected. What's important to be aware of, however, is that there are very limited resources available to treat those who have COVID-19. These limited resources include ventilators, which are machines that support breathing, as well as space in the areas of the hospital where very sick patients are taken care of. These are called intensive care units or ICUs, and limited availability of healthcare workers to provide care. We are also limited in our understanding of how medications work against COVID-19 and which medications work and why. Some medications work well in one patient, but do not work well in others. These medications are also limited in their supply. And for this reason, only patients who are very ill and very sick and are having difficulty with breathing are those who are recommended to be in the hospital. The majority of patients, as you will see, can recover well even without treatment if they were previously healthy. As you can see from this pyramid, the vast majority of those at the bottom of the pyramid are those who are infected but did not have symptoms. Those who are symptomatic with mild symptoms, with either no or mild pneumonia, in addition to those who are infected without symptoms, comprise 80% of those who have COVID-19. Those with severe disease, the ones that require hospitalization and support with breathing, are about 15% of those with COVID. And those who are extremely ill, mainly the elderly and those with other health problems that have other organ systems that are affected in addition to difficulty with breathing, they end up in the ICU or die from the virus, comprise about 5% or less of those with COVID-19. So is there a treatment or a cure? And unfortunately, the short answer is no. We are currently in the process of vaccine development, and although that is being advanced at a pace faster than what is typical, in order for it to be done safely and to know whether or not it works, that process can take anywhere from 12 to 18 months. Again, treatment is in the form of supporting those who are having difficulty with breathing with ventilators and those who have other organs that are not functioning well with support. However, medications such as antibiotics have not been effective, at least not consistently for all patients. There are some medications which are used experimentally. You may have heard of them in the news. However, again, they may work in some patients and not work in others. And some of them also have very dangerous side effects, which caution doctors to not use them for everyone that has COVID-19. So without a vaccine or a treatment or a cure, how do we beat COVID? This is an information piece provided by the Center for Disease Control and reinforces some of the public messaging that you have already heard to stop the spread of the germs, to avoid close contact with people who are sick, to avoid touching your eyes, nose, and mouth, to wash your hands, often with soap and water for at least 20 seconds, to isolate yourself when you're sick, except to get medical care, cover your cough or sneeze with a tissue, then throw the tissue in the trash, and to clean and disinfect frequently touch objects and surfaces. Although we can't necessarily kill the virus, we can prevent its spread. This is just a lighthearted way of describing how this is affecting us socially in order to create distance where we once would shake hands to greet someone or perhaps give them a hug. These are some creative ways for us to stay in touch and communicate with one another while keeping socially distant and keeping safe. This graph demonstrates how easily the virus can spread. The blue line represents the spread of the virus if movement is restricted, and the red line represents the spread of the virus if people are allowed to socialize, leave home, go to restaurants, go outside, to freely move about in society as we did before this pandemic. On the bottom left, you'll see free movement where people in red, which are people who are infected, are passing the spread of the virus to people in gray because they are coming into contact with one another. And as you can see, those red dots are rapidly multiplying. If you look at the figure on the bottom right, the blue dot, which are also people who are infected, are not spreading as quickly because those in the gray dots are restricting their movement. So it's preventing the virus from spreading as quickly. There are many challenges that we've encountered associated with this pandemic, specifically here in Michigan and here in Detroit. On the upper left-hand corner was an alternative site for providing care to those who have COVID in the setting that the hospitals became overwhelmed. It was known as the TCF Center. Fortunately, the volume of patients that contracted the virus was mostly managed in the hospital setting, a traditional hospital setting, and very few individuals had to utilize this alternative location. There's also been the opportunity to learn more about the virus, specifically ways to treat it, and so Detroit was selected as a location for doing research on potential medications to treat the virus. And unfortunately, we also made headlines by the impact that it's had here as well, with a significantly larger proportion of our population testing positive for a variety of reasons related to social and environmental factors. This graph shows where Detroit falls relative to other major metropolitan cities in the United States and the number of deaths that we've had relative to our population. There's been at least one death for every 1,000 individuals who live in the city, placing us within the top 10. This graph represents the distribution of cases within the state. These are patients or individuals who tested positive for COVID as well as deaths. The large bubble around Detroit shows the concentration effect in that major metropolitan area, as well as directly west in the Grand Rapids area as well. If we look even closer in Detroit by zip code, the darker the color, the larger the concentration of positive cases. Again, these are positive cases, not necessarily deaths. Freedom House is located within the 48209 zip code. The red circle shows that it's somewhere in the middle of the spectrum with regard to number of cases. Some of the worst numbers, as you can see, are in northwest Detroit. This information is provided by the Department of Health. It's known as a heat map, where the color red represents a higher concentration effect of cases as well. Again, some factors that influence this concentration effect, as we will see in the next few slides, have to do with age. Those who are older are at higher risk, as well as population densities, individuals who have other medical conditions, and we also know that race is also playing a big role in those who contract COVID-19 and those who die from the disease, with a higher proportion in those in people of color and minorities. This is information for the city of Detroit provided by the Department of Health. It shows that the age range from 60 to 69 has the higher proportion of confirmed cases by age. That's over 20%. If you look in the lower left-hand corner, the vast majority based upon race are individuals who are Black or African American at 65%. In the bottom right-hand corner, you see that women are more likely to contract the virus. This slide represents deaths. Going back to that same circle in the bottom right-hand corner, even though women are more likely to contract it, men are more likely to die. Once again, we see that African Americans also bear a disproportionate burden with regard to deaths from COVID. This is even higher at 80%. And then once again, looking at the deaths based upon age, the higher you are in age, the higher you are, unfortunately, to die from disease, with the vast majority being individuals 60 to 69, 70 to 79, and 80 plus. This slide shows us the time progression. Up top, we see confirmed cases, people who have tested positive, and on the bottom, we see deaths. First cases were reported in February. First deaths were reported in March. We reached a peak in the number of positive cases at the beginning of April. And fortunately, because of the implementation of social distancing and isolation and quarantine, we have seen a steady decline in cases and deaths since the beginning of April. Testing is extremely important. You don't know how much virus is in the community if you don't look, and if you don't test, then you can have a false sense of security. However, the number of tests in the area have been increasing consistently. Thus far, over 30,000. The vast majority of those results have come back. And as you can see in the bottom, that the majority of people who are tested are negative. About 20% of people who are tested are positive. And that doesn't mean that 20% of the population is positive. It's 20% of the people who decide to go get tested, and that's likely individuals who are at higher risk, whether it's healthcare workers who might be exposed, a person in the community who think that they may have come into contact with someone who has COVID, a person who has symptoms, or someone who is elderly or has other medical conditions. So here are some numbers to help understand why COVID has hit Detroit so hard and has affected us more than it has affected other cities and other parts of the state. Urban poverty plays a role. Over a third of those who live in Detroit live in poverty. That's compared to 14% in Michigan and 13% nationwide. We know that access to health care and poor health makes you more vulnerable. 15% of Detroiters live with disability and 11% do not have health insurance. That's compared to 10% who live with disabilities in Michigan and 6% who are uninsured in Michigan. So these numbers are much higher in Detroit than they are in the rest of the state. Racial disparities. Detroit is almost 80% African American and 8% Hispanic. As I mentioned earlier, the disease is disproportionately affecting minorities. And housing plays a role too. One's ability to socially isolate or control who they come into contact with when they go home, say in a group setting or an apartment complex, is much more challenging than if you are a homeowner. More than half of individuals in Detroit are not homeowners, they rent, and that number is much higher compared to the rest of Michigan, which is 30%. Another challenge has been trying to understand why the symptoms keep changing. Again, very early on, at the very bottom row, simple recommendations were given to identify those who might have the virus: fever, cough, difficulty breathing. And for a time, it seemed like every week new recommendations were coming out about less common symptoms that were associated with COVID-19. These include headache, sore throat, loss of taste and smell, chills, and muscle pains. Simply put, our experience and knowledge of the virus has been growing with time. And the most common symptoms are the ones which are pretty easy to identify and the ones which we are aware of at the very beginning. The ones that are less common, perhaps you would only see rarely, were much more difficult to identify as symptoms of COVID. Perhaps they were being attributed to another type of illness or another infection. And so as the numbers of cases increased and more people were contracting the virus, it was somewhat easier to identify those rare symptoms. Another challenge has been the changing recommendations from the public health institutions and leaders. In the very beginning, this is a headline from January 30th from the Wall Street Journal that reads, "Coronavirus fears drive demand for face masks, but some experts doubt them." Indeed, there were individuals in the beginning of the pandemic who were skeptical that face masks were appropriate or effective in preventing the spread of the virus. Experts have now concluded that using face masks are essential from a public health point of view to either prevent spreading it if you have it or contracting it if you don't. Again, once in the beginning, there was very limited information, and as time has progressed and we've learned more, these recommendations have become a bit more reliable, but it certainly has been confusing and frustrating. The issue has also become very political. Unfortunately, we are in an election year. We'll be voting for a new president in November. And there are reasons on both sides, both the conservative and the liberal side, to use this as an opportunity for political advantage. This is represented in how states decide to implement restrictions, as well as the effect that it's had on the economy. The health of the economy is something that is often attributed to political leaders, and so political leaders find a variety of motives to influence the way that the pandemic is being managed in order to minimize the impact that it's having on the economy. Another important question is, why is mental health being affected? Certainly all of us are experiencing some form of direct or indirect contact with the virus, whether that's a loved one who has been affected, or if we've been affected ourselves, if you've been isolated, quarantined, socially distanced, not able to connect like we're used to. All of these are leading to a variety of issues that are manifesting in the form of mental health. This includes depression and anxiety, fear, issues related to finances and the economy. And so quarantining makes it more difficult to distract ourselves from existing mental health issues that were already there, and it may also be creating those issues that weren't there before. This slide here just emphasizes that coronavirus isn't just threatening our physical health, but our mental health too, and the importance of being aware of that and seeking out help and knowing what resources you do have available if you are experiencing some of these mental health issues. We've also been overwhelmed by the amount of information that's coming out, whether it's through social media, the internet, traditional news outlets. How do we process all this information? And what happens if the information is in fact not true? The United Nations launched an initiative to fight COVID-19 misinformation through a program known as Digital First Responders, meaning if information was found on the internet that was false, the United Nations used its resources to remove that information from the internet so that individuals will not be misled to make poor decisions that might adversely affect their health. Our advice is to stay informed and stay educated. That it's obviously very important. However, knowing who to trust has a lot to do with your immediate community. Relationships that have been pre-existent, organizations and individuals with whom you've already established a form of trust should be the same sources of reliable information that you use now. Anyone who seeks to take advantage of others through misinformation are likely not individuals that you've had a previous relationship with, or that you are familiar with. Large organizations have to be accountable to society, and so even though they don't always get it right, entities such as the United Nations, the World Health Organization, the Center for Disease Control are much more publicly accountable than smaller organizations or individuals who put out information that cannot necessarily be verified or relied upon. So humans sit in those positions, even at our best organizations, and they may still make mistakes that have to later be corrected. However, they are less likely to be in a position to be intentional with misleading the public or taking advantage through misinformation. Personal stories are important to allow us to connect with one another and also know who to trust. Those who have been affected by the virus are more likely to be empathetic and understanding to what you're going through and what you're experiencing right now. My personal story as a healthcare worker, a physician who works at Detroit Medical Center at Children's Hospital, may be different from yours. However, I too have experienced some of the same feelings of fear, anxiety, loss, and the unknown. Early on in the pandemic, before we had a lot of answers, unknown mysteries created a lot of possibilities for either becoming seriously ill myself or perhaps bringing the infection home to family. That, of course, created a lot of anxiety and change in behavior and routine, separating myself from my wife and my 8-month-old daughter at home. I was shortly tested after being exposed at the hospital to a healthcare worker who was positive, so I experienced the discomfort of having that swab placed so far in the back of my nose that it felt like it was touching my brain. In the bottom left-hand corner, I also had the blood draw to test for antibodies. I've also lost friends and family to COVID. I've had 2 aunts pass away in the past 2 months. A family's friend, mother, was one of the headlines in one of our local newspaper whose body was not found. And a family friend's father, 2, in fact, have also passed away due to COVID. And so this has certainly hit home. This would be a great opportunity to share how COVID has affected you. Unfortunately, we are not able to do this in an interactive environment as we did before. However, I would encourage you to take a moment to pause and reflect on the same type of experiences and feelings that I just described. If you have, in fact, been experiencing issues related to mental health, the first piece of advice is to utilize the resources at Freedom House. They are your best source and partners for getting help. The case managers, the executive staff, administrators, social workers. The most important thing is to first recognize if you are experiencing some of these mental health issues, and the second step is to get help. Again, for questions not addressed to this presentation, we encourage you to attend the future webinars. Those questions can be asked then, and we will also be providing translation services. If any questions are of an urgent nature, please share them with Freedom House staff, case managers, and social workers, and have those questions shared with us. I leave you with some sense of hope that we will get through this together, and relying on the very things that have brought us through other challenges in our life. Not a single person listening to this presentation hasn't experienced some type of adversity, if it's not the very reason that brought you to Freedom House today. And so those past experiences, which gave us a sense of hope, are the same things that we rely on to get us through this challenge as well. The love of our family and friends, our faith, and the reassurance that the world has seen challenges like this before, and we have gotten through them together as a community that's small and a community that's large. At the very least, we have the common goal to see better days. So I leave you with that, and I look forward to speaking with you again soon. Thank you.